To India now, and it's eased its lockdown to much lower levels. COVID-19 infections have surged, though. The country has recorded over 10,000 new infections in a single day, with nearly 300,000 infections overall. Nearly 8,500 people have died. Rebecca Bondon, our India correspondent, joins me now from Mumbai. So we heard from the head of the Indian Medical Research Institute saying that India is such a large country and prevalence is very low. Rather confusing when you see the rise in infections.
Yes, absolutely. Many people have said the numbers are still relatively low. Given the size of the population, India has a population of 1.3 billion people. But now we have seen the numbers rising. There are close to approaching 300,000 confirmed cases of COVID-19 in India. And that means it's now overtaken the United Kingdom to become the fourth worst affected country in the world. And there are predictions by health experts that the numbers could increase even further. Delhi, for example, is talking about the possibility of 500,000 cases by the end of next month. And really the worry among health experts is now the fact that the country has opened up quite significantly. We've had this nationwide lockdown that's been in place since March the 25th. But gradually and in recent days, there have been more and more relaxations that have been introduced, particularly in states including Delhi, where they've seen temples, shopping malls and restaurants reopening. Here in Mumbai, which is located in the state of Maharashtra, which has the highest number of infections in the country, the lockdown has remained much stricter, and they've allowed some relaxations, allowed some people to return to work with 10% of offices functioning, and they've allowed more shops to open, but they haven't yet allowed shopping malls to reopen, places of worship to reopen here, because the number of cases really is a struggle for the healthcare system to cope with. But really there is that big concern about how the numbers are continuing to increase and how they might rise further. Domestic flights have also opened up in the country last month as well. And that's, again, another factor that could increase cases across the country. So really these numbers are being watched very, very closely, and there's the potential for them to go even higher.
I'd like us to expand on a point you touch on, which is the healthcare system. In Mumbai and in Delhi, what has been the consequence of the easing of the lockdown and the rise in the number of infections?
In Mumbai, the lockdown has remained much, much stricter, although they have allowed some relaxations, which I mentioned there. And the Chief Minister of Maharashtra today said that they wouldn't revoke these relaxations that have already been allowed. But yes, the worry is that these do actually impact numbers and could lead to a further increase in the already very high numbers that we're seeing in a city like Mumbai, which has a very large slum population. More than 40% of people actually live in slums in Mumbai. And in Delhi, for example, with the relaxations, where there have been even more relaxations, the numbers seem to be rising very, very rapidly. And Delhi is talking about needing some 80,000 hospital beds by the end of next month. So it really needs to add a lot more facilities. Mumbai's facilities have also been very strained in terms of its healthcare resources. For example, if we look at figures that came out this week from local authorities here, it showed that 99% of the beds for intensive care unit beds were actually occupied. So that's really a big worry. There's a huge shortage of beds in terms of critical care. And this is the case in both Mumbai and Delhi, where we've seen these reports of patients that are being shuttled from hospital to hospital, and they're struggling to find a bed. And sadly, some people have actually died in these circumstances, according to reports. Mumbai has already built quite a few extra facilities. It's built some temporary hospital facilities in one of its business districts. It's also added quarantine facilities at the car park of its racecourse, and in indoor stadiums and venues it's added a lot of hospital beds. So it is increasing the capacity, but with the potential for more and more cases, health experts are still very worried about the situation.
Add to that monsoon season, which starts now in June to September, which ordinarily would have presented its own challenges in terms of outbreaks, but we're also dealing with coronavirus here. What is the plan where that is concerned?
That is another major concern, and some people are worried that because authorities here have really been focusing a lot of their efforts and resources over the past few weeks and months on dealing with the COVID-19 situation, that they may not be very well prepared for the monsoon season. And every year in Mumbai, the city actually really struggles with flooding, and a lot of people have lost their lives in recent years because of flooding and because of damage to infrastructure that's caused by the monsoon. So there are questions about how prepared Mumbai is in terms of actually readying for the rains. And then there is the fact that the rains also lead to a further spread of diseases like typhoid, cholera, dengue fever. These are all things that we see a spike in during the monsoon season in the city. So if there are all these instances of people suffering from these diseases as well, that's also going to put a further strain on the health resources, the health facilities and the beds, which are already in short supply, and even the medical staff as well, doctors and nurses. So there are questions being raised about how the city will actually be able to cope with all these additional patients coming into hospitals. But as I mentioned, there are efforts underway to add more and more facilities. So we just have to hope that they will be enough as the number of infections continues to spread across the city.
And that's where we'll leave it with India correspondent Rebecca Bundun in Mumbai for us. Thank you very much.